So good morning, everyone. Thank you for joining today's live session. This is one of the most exciting sessions that we've put on to date. And I got a message from an old friend around a week or two ago, and she's very high up in the civil service. And she said, Harry, do you have to release the workplace health report when you did? I've got a pretty big report going on at the moment. Do you have to do it? And I said, Sue, I'm really sorry. I've got to release this report because there's too much data to hold back from everyone. But all jokes aside, the reason why we produce this report is because often data is really lacking in the wellbeing space, and we need to make data-driven decisions. Now, if we look at our directors board, for example, they're the people signing these things off. Often they need that data to be able to make those decisions, put the investment that's required into wellbeing, and to see those returns as well in terms of the human and business returns going forwards. So most of you have downloaded the report, I'm sure, and if you haven't, please download it. We'll send it through afterwards, because there's just so much data that you can take from musculoskeletal health through to mental well-being through to productivity. But the purpose of today's session is not just to go through that data, it's also to go through the biggest thing of the so what. What do we need to be doing going forward? How can we action this data, and how can we improve the well-being of not only ourselves, but of our team as well? So good morning to everyone from all around the globe, or good evening, I should say, if you are on the other side. So if you've not joined these sessions before, please use the chat. I can see the chat popping off and I already can't keep up with it, but that's fantastic. So if you've got any questions, please send them through in there. We'll try and get round to all of them in today's session, because we want to make it as personalised as possible to you. But if we don't get round to it, I will answer the questions later on today. We'll also send through the session recording and the slides after the event. And so you've got things to access going forward. So if you say, what I don't want you to do is just scribbling down loads of notes and developing RSI in your wrist, for example, you can just come back to this recording and this session and to the specific bit that you may have found really enlightening for your workplace. And the final thing that we'd ask you to do is, if you do enjoy it, then please share it with your colleagues. Please share it on LinkedIn, for example, because the more people that can access these free events, the happier our workplaces will be and the better off we will all be going forwards. So one thing I wanted to touch upon before diving into the data is that workplace health is a minefield at the moment. We calculated that there are over 400,000 apps on the iOS and Android stores covering health and well-being. And when we look at workplace health, it's very disjointed. You've got your EAP somewhere, you might have occupational health and physiotherapy, you may have wellbeing platforms, all of these different areas. And there's no one real gateway to being able to support employees with their own wellbeing and you as the leaders with the data-driven decisions. And that's really what Champion Health do. And so we built what we believe to be the Netflix of wellbeing, one platform that brings together all areas of wellbeing, from physical health through to mental health, social wellbeing through to financial wellbeing, personalized to every employee to put them in control of their well-being. But not only that, you as a senior leader can get the first party data in terms of your workforce. It's all anonymized, all aggregated, so you can make data-driven decisions going forward. So if that sounds too good to be true, we would love to take you through it in a 20 to 30-minute demo. Jack, I think, has said good morning from Champion. He's one of the people that take you through it alongside myself. And we'd love to just share what we can do to support your organization if we're not working with you already. Now, in terms of the data today, it's really important for us to just acknowledge the sample size, how the data is collected, to make sure it's got the integrity behind it, first of all. So all of the data is firstly anonymized and aggregated. So we can't identify individuals within here. And even within our platform, the way we work with organizations, it's all aggregated. Now, we never sell on the data to third parties. I've made that commitment from the outset. No matter how much insurers try and pay us for the money, for the data, we will never do that. That's not in our business plan going forward. But what we want to do is to inform policy and procedures going forwards at government level, all the way through to local authorities, but also to inform you as leaders within your organizations to act upon the data that's occurring, because without the data, we're taking guesswork into it. In terms of the sample size, there's been over 2,000 people that have gone through this sample and over 100,000 data points specifically within. So really rich sample size within here that we're going to share with you today. Now, in terms of your speakers, many of you I have met, so lovely to see you and those familiar faces. Some of you I've not met. So I'm the co-founder and CEO of Champion Health, and following a friend taking their own life 3.5 years ago, I set up Champion Health to really drive a positive difference within organizations and within the workplace. And so that's the driver for me at Champion Health. And I'm very proud that we're now working with global organizations to support them with their wellbeing strategies and wellbeing solutions. And we're also joined by one of my favorite people, Laura. We are extremely fortunate to have Laura within the team. Laura is the head of product. Works previously as a psychologist within the NHS, and brings a huge wealth of information and the data. She compiled this report alongside our academics and the rest of our team, so we can't have asked for anyone better to talk through the data and what this means for workplace health going forwards. So what we're going to start with is the topic of mental health, one of the biggest areas that we do need to focus on within our wellbeing strategies. And what I'm going to do is talk you through the key points of the data first of all. That'll take a minute or so. And so please take notes, but again, the recording will be available afterwards. And then we're going to get into the so what, and that's where the real meat within the session will be. So first of all, using the validated measures of the PHQ-9 and the GAD-7 for depression and anxiety respectively, what we know is that 58% of employees are experiencing mild symptoms of anxiety, 52% are mild symptoms of depression. So they're people that we need to support. We need to be proactive in our support with. But the 24% and the 22% are the ones that are experiencing moderate to severe depressive symptoms or symptoms of anxiety. And that will be having huge impacts not only upon their working life, but outside of their working life as well. So there's a big challenge there as to what we can do, how we can react to those people, but also how we can be proactive and focus more upstream to being able to support the people that may be experiencing mild symptoms or no symptoms at all. Now, in terms of age ranges, and this is fascinating in terms of the demographic data, and we're going to dive into that in various areas, but 25 to 34-year-olds are experiencing the highest levels of anxiety and depression within the workforce. And there are many reasons for that. One is potentially a lack of identity and finding their way. One may tie into financial well-being, and we're going to talk through that as well. But I must also add that 40 to 50-year-old males are the most at risk when it comes to suicidal ideation, for example, and taking their own life. So this data represents anxiety and depression within here, and 25 to 34-year-olds are the most at risk within our organizations. And the final element that I'd like to go through within mental health is 18% of people within our organizations are experiencing or have a current mental health diagnosis, and 1 in 5, just over 20%, report that poor mental health is impacting their productivity at work. So that's having a huge impact upon what is the business and the bottom line as well. Now, the final element is the proportion of people that are seeking support for their mental well-being. So it's less than 10% at the moment are currently seeking support, 30% have previously sought support, and then my face is in the way of the final statistic, 61% have never sought support within here. And so we know there's a bit of a mismatch with the proportion of people that are experiencing challenges and difficulties with their mental well-being through to those that are seeking help. So Laura, my first question to you is, what can we do to get more people seeking support for their mental health that are struggling at the moment?
Yeah, and I completely agree that it's quite shocking that 61% have never sought support for their mental well-being when you look at it by the side of the GAD and the PHQ results, where actually levels of anxiety and depression are generally high. I think the biggest thing for me is, okay, having support, that's important, but actually making sure it's accessible and available, and actually people know that it exists is one of the biggest things for me. It's that visibility, because if an individual is struggling, but actually they're managing, so perhaps experiencing those mild symptoms of anxiety and depression, they're not at crisis, they're not in need of immediate support, then actually that population might not have the familiarity with the services that are available. Perhaps these are conversations around mental health that they haven't really had before. And actually the question is, how do we how do we reach those people, and how do we get them into the services that a lot of organizations do actually have? So we work with so many people who have in-house counseling services, EAPs. So the support, I think, in the most part is there, but it's then how do we get people to engage? And for me, it's the visibility of that and the awareness that it's actually there.
I completely agree. And we know that 94% of organizations have an EAP and an employee assistance program. How do we get that into people's hands and get people talking about their mental well-being? What does the role of role modeling specifically play as well within that?
Yeah, that's such a good point. Role modeling is so important. And I'm sure people who've joined our previous sessions have heard all about how actually, as a leader, one of the best ways to start that mental health conversation, to get people talking about it, is actually demonstrate that you yourself are comfortable in talking about it, role modeling that vulnerability. Of course, we're not asking everybody to share their life story, and there are definitely, it definitely depends on the individual who, depending on how comfortable they feel, but actually showing that it's okay to talk about our mental health is really powerful. I'm sure you've noticed in conversations, if you share with someone, actually, over the weekend I was kind of struggling and I was, finding things a bit difficult. More often than not, they would then come back to you and say, oh yeah, well, actually on this day, I didn't feel so well as well. So actually that role modeling is so powerful when it comes to opening up that conversation. I guess the second part of it, in terms of how we get people in, is Prof. Jim McKenna's favorite acronym, which I'm sure will be mentioned throughout the session quite a bit, is the FEAST model, or the EAST model with a bit of fun at the beginning. But for me, it's that making it easy to engage with. So making it one click away. I'll just very quickly share an anecdote. One of the clients that we were working with shared some instructions on how to access EAP services. And there were so many steps, and there were so many places that you had to go, then you had to look, and then you had to sign up. And I was just thinking, putting myself in the person's shoes of someone who is experiencing difficulties at the moment, that actually they're feeling really anxious. Are you going to be able to follow all these things? Are you going to have the motivation to do that, or even to know where to start? So really making it easy and one click away is the golden ticket for me.
Absolutely, and reaching people where they're at as well through personalization, we know as part of our platform, is absolutely vital, because there's still a proportion of people thriving, and the focus needs to be how can we keep them thriving. But the people that are struggling, I think we counted 15 clicks for them to access their EAP services, and that's 14 too many for them. They need to see it there and then. The communications need to be very clear, and I couldn't agree with that anymore. One thing that I'd just like to ask about as well is around training and the importance of training. And I think it's important to recognize that workplaces have a role. Now, they can't do everything, they can't resolve all of these issues, but they have a role to play for employees when it comes to their mental health. What role does training have, and what do good training programs constitute and look like from your experience?
Yeah, well, the big piece is awareness and really prevention. So a good training program will, of course, cover the signs, the symptoms, but then also how it can support that individual to have that conversation with people. And I'm sure we'll come back to this in the next section around suicidal thoughts. But it can be really difficult and daunting to have those conversations if you've never done it before. And I think as a society, as cultures in workplaces, that we are definitely getting better at doing that, but really giving people the practical skills. Again, it's going beyond awareness, turning that into action, which is the key thing for me. And I think there's also an awareness of integrating diversity and inclusion in the training sessions as well. The data very clearly states, as you spoke about, that it's the younger generation that perhaps are experiencing more difficulties. And actually lots of different demographics will be experiencing different difficulties. So an awareness of that will no doubt kind of transform the way that leaders view and understand mental health, and know what signs to look out for.
Yeah, just something to add on top of that as well. I think the training course is all well and good, but then it needs to translate to action.
Yeah.
And you can have all the training in the world and the best trainers in the world and the best platforms in the world, but if we don't then actually take it into action, role model those behaviours, it's not going to have any impact, and arguably it could backfire even further. And I would argue that no service is potentially better than lip service with these things as well. One thing that we've got Matthew, who's asked a question of, what role do you feel lived experience consultants can play directly in reaching the 61%? So people that have gone through mental health difficulties, that lived experience, how do those stories that they can share, that experience that they found, really have an impact upon other people that may be experiencing other challenges going forwards?
I think the key thing you just said is stories. And obviously we had a training session with our videographer last week, who really shared the power that stories can have, and individual stories, because as human beings we communicate through stories, and that's what really resonates with us. So it's much more powerful hearing someone's experience, what they've been through, their resilience, how they bounced back from what they were experiencing, versus seeing a statistic on a slide, because there is that disconnect, isn't there? We connect with human beings. So I think there's a massive role for people with lived experience, whether that's getting people in from the outside to come and speak to individuals, but then also people internally, so employees that have actually gone through, experienced whilst working in that particular workplace, because again that just really cements that, oh, actually I can resonate with that story, and it will really help.
And I've got a friend recently that's felt uncomfortable talking about their mental health until they heard Jamie Lang. So someone from Made in Chelsea, and whilst I don't necessarily agree with those reality TV shows from a mental health angle, he's been very open about men's mental health and anxiety, and that gave the confidence for my friend to then openly talk about their mental health and know that it's something that everyone does at some point in their life, experience challenges inevitably. So thank you for sharing that, Laura. I'm going to go through a few of the comments, and for anyone that's posting in the Q&A, if you can pop your questions in the chat, that would be fantastic as well. So Christine, hello Christine, first of all, mentioned one of the biggest issues with EAPs is the majority to not cater for people with conditions beyond mild to moderate and have nothing to offer them, which can be devastating for the individual. I couldn't agree more. I think we really need to focus in that procurement process and when selecting the providers, what they can and what they can't do. And we need to communicate to employees what they can and what they can't do. Because if someone's in crisis, calling up their EAP and they can't cater for them and they turn them away, that's really dangerous. So that's something that I'd really recommend to everyone within here. Nuz, hello to Nuz as well. Great to see you. Talking about the atmosphere of trust. So when leaders show that a little bit of vulnerability and empathy, that's one of the greatest things, and from her personal experience as well. So thank you for that. And Carl has asked around how widespread in the UK is the rollout of mental health first aiders. So it's been one of the campaigns that's taken a lot of organisations have implemented it in their wellbeing strategies. There isn't any research to show the effectiveness of it yet. The mission of Mental Health First Aid England is to get 1 in 10 trained. And they're really focusing at the moment, I know, on the quality of the trainers. But at the moment, there's no specific evidence to suggest that mental health first aid is effective. But I have heard anecdotally from organisations that it's had an impact if it's implemented. And that's the big if it's implemented in the right way. The support is given to the mental health first aiders and to the people around them as well. And Sarah's agreeing with me. That's wonderful, Sarah. Thank you. And training without action is often actually detrimental. So just as a bit of a summary within here for the mental health section, because we've got so many other areas of wellbeing to go through today.
Could talk about this for ages.
We could have a whole session on it.
Fill a whole hour on it.
But what we need to do is to really get the awareness, and I think the awareness has been raised within our organisations, but translating it into meaningful action, really focusing on supporting the 25 to 34-year-old bracket in getting them to understand more about their mental health and feel that they can talk about it openly as well, and providing the right services from EAPs all the way through to platforms that are joined up where things are one click away and it's personalised to every individual is absolutely vital within here. So on to the next topic, and I must just add a trigger warning when it comes to self-harm and suicide. And we were talking about whether we include this, and we have to include it because 1 in 12 people within our organisations are experiencing self-harm or suicidal thoughts at any one time. And I just want to share with you, and I've not openly shared this beyond the Champion Health team, that not only did my friend and mentor 3.5 years ago end up taking their own life, but I had 2 people, one person that I used to play football with when I was a junior playing football, and one person that I used to coach cricket. And they were both the life and the soul of the dressing room. And they both tragically ended up taking their own life between the ages of 18 and 25 last year. So there's so much that we can do within here. And that's the hope that I want to give you first of all. So 1 in 12 people, as I mentioned, are experiencing thoughts of self-harm or suicidal thoughts at any one time. Now, if we just think about the human angle, I don't think we need to go into the business angle. That is a frightening statistic, first of all. And if you think about how many employees you have in your organization, you can potentially see the risk there. So if you have 600 people in your organization, that's 50 people experiencing those thoughts on average off the back of our data. Now, when we also look at the differences again in demographics and gender, 51% of people that are experiencing suicidal thoughts are female, 74% that is currently seeking treatment are female, and 25% are male. Now, when we compare that to the data around people that take their own lives, and it's 75% male and 25% female. So that's just something to bear in mind within this, that we know that men are not seeking the treatment, not seeking the support at the moment. And that's the first thing that I'd love to ask you, Laura, is what can we do to support men's mental health to be able to get them into those services? It seems like at the moment, there's this very similar proportion of people from males to females that are experiencing suicidal thoughts and self-harm, but there's a big disproportion in those that go through with suicide. So what can we do for the men within our organisations?
Yeah. I think the first thing that comes to mind and what really resonates is that actually it's those stories and it's the sharing of lived experience, because everybody views mental health differently. They'll have their own kind of preconceived ideas, and unfortunately we've lived in a society for so many years that men just don't talk about how they're feeling, and it is definitely changing. But I think because that still exists, then we need to be approaching it slightly differently, and actually getting that role modeling and getting those real stories out there is going to connect to individuals on a different level, and men in particular. And I know that there are, of course, excellent charities that focus on men's mental health, raising awareness of that conversation are also kind of powerful things that you can do.
I think it is, I completely agree, Laura, breaking down that stigma, making sure that there's a safe space, and psychologically safe spaces was mentioned above. And for those that aren't familiar with psychological safety, that's really the bedrock of not just the innovation within the workforce, but the well-being. And we've got loads of things that we can share with you on psychological safety. But it's breaking down that stigma, making sure that men feel comfortable and open to talk about their mental well-being. And having those role models in place and storytelling, we know, is absolutely vital within there. And interestingly, within our platform as well, we find that men are using various things within there, from accessing yoga, for example, when we didn't think that they necessarily would do before. Yeah. So making sure you're giving them the right platform as well to being able to access things in their own time. And so they can, it's free from stigma for them, and they can, within their own time, open up about how they're feeling. Yeah. I want to ask you another question, Laura, if that's okay, on how we can prevent suicidal ideation. Now, we can't prevent it across the whole of the workforce. Again, I want to be very clear on that. But what can we do in terms of our preventative strategies to reduce the risk of suicidal thoughts within our workplaces?
Yeah, I think I'm glad you kind of caught yourself there, because I think it's very true that actually you can't prevent it. You can't prevent any difficulties happening. And actually these kind of thoughts are more common than we think. So I think there's a big piece in the preventative aspect of normalization, of raising the awareness. Actually, these are thoughts that quite a few people have, and actually you're not mad or crazy for experiencing them, that actually quite often it's a normal response to a situation that people find themselves in. I think what then needs to change is the conversation that we then have around that. So if someone is feeling that way, then actually they can verbalize that and feel comfortable and safe to do that. And for me, that comes from training, from raising awareness, from being able to have those conversations, as I mentioned earlier, the kind of questions that you might ask someone that that would just help to facilitate that conversation in an otherwise kind of quite a scary conversation that you might feel that you can't have. But it's just so important to open that conversation up.
Yeah, I couldn't agree more. And Craig's made a really valid point within there, that if we do reinforce the phrase of men don't talk, men won't talk. And I've spoken to Dr. Stephanie Fitzgerald from Rolls-Royce. And that's a big belief of hers from the clinical psychology world, that we need to get people openly talking, and only saying men don't talk about things only increases that stigma for them. So thank you for sharing that as well, Craig. And we've got some more wonderful comments all the way through. Thank you, Liz. Thank you to Katrina, Christine, and many more, Tracy, as well. So in terms of self-harm and suicidal thoughts, we can't prevent everything, but we can do things within our organisation. Our employees on average spend 1/3 of their lives at work. We can do things to make sure it's a psychologically safe space so they can openly talk about things. And the training, again, is absolutely vital, so people know what to say, what not to say, how to support, and where to signpost them going forwards. So on to the next topic of stress, and that's a huge area. And we've just taken stress as a slightly different topic from mental health within here. And what we've done is to look at work-related stress and home-related stress. And it's important to note that not all stress is bad. It's a biological and physiological thing that we need to be able to thrive. But what we don't want is for our stress to be turned on for too long, that will lead to negative impacts upon our work, our health, our happiness, our relationships, and performance as well. So when we ask people, do you experience any stress at work? If they say yes, it will then pop up these two questions of stress has a negative impact, but I can cope, and I'm overwhelmed and with stress and cannot cope. So 9% said that there's no stress at work at the moment. 56% stated that there's a perfect amount that helps me thrive. That's really where we want our team, in that sweet spot. 34% said that stress has a negative impact, but they can cope, and 1% said that they're overwhelmed and cannot cope. Now, when we asked them, does it impact your productivity as well? Almost 30% of people said that their stress levels are impacting their own productivity. So that's a huge thing for us to focus on in a moment's time. Now, when we look at work-related and home-related stress, and actually these two things aren't necessarily separated, especially over the last couple of years. What we bring in from our relationships into the workplace, we're only human beings, we're not robots that can distinguish 8 o'clock in the evening if you're not working them through to 9 o'clock in the morning. But workload was by far and away the highest citer of work-related stress. It was then a lack of control, a lack of support, and senior members of staff. And when we look at causes of stress outside the workplace and at home, it was around relationships for 33% of people, financial pressures for 30%, and then my chat function is just in the way at the moment.
Parenting is 26%.
Thank you, Laura. I've got the chat so I can see everyone's chat. So Laura, you're going to have to save me on those ones, but thank you. So parenting as well. So then on to financial well-being within here. We know again that 25 to 34-year-olds are experiencing the highest levels of challenges with their financial well-being, and that's something that is a huge factor that ties also into their mental well-being as well, with the cost of living increasing, it being more difficult to getting on the housing ladder, for example. So where I would like to start, Laura, if that's okay, is around financial well-being and what we can do to support, especially that age range, but other age ranges as well, with their financial well-being within the workplace.
I mean, I don't know about you, but talking about money makes me feel quite uncomfortable. And I think that's where most of the problem lies. It's very difficult to bring up that conversation. So actually raising that awareness, tying it into awareness days. I know there's the Talk Money Week, and opening up that conversation. Like with everything, I think we do sound a bit like a broken record so far, but sharing those difficulties, and that actually many people are experiencing financial worries. You know, these individuals aren't on their own. I know that the pandemic has had such a significant impact, so being able to identify those causes of stress, firstly for individuals. So there's the individual level, but then there's also the kind of the team level, and raising that awareness in terms of those conversations.
Absolutely. And to add to that as well, for any organisation that's not a living wage employer, that's something that we'd strongly look at, because it's all well and good raising the awareness and the education of financial well-being, but if we're not paying fairly and appropriately, that awareness and education is not going to be effective. But I think it's financial well-being is taking a movement in my eyes, from what I can see, away from purely how much do you earn, through to what's your relationship with money. And that's a major area. But again, we need to personalize our initiatives, because there are a proportion of people that are in debt and finding themselves in financial distress. But there's a large proportion of people that are in a financially stable position. Again, it's looking at that proactive piece of preventing them getting to that point, and then the reactive piece to supporting them. Bex has mentioned this is a huge area. Leadership tend to forget what it's like at the start of their careers and get on the property ladder. And I think that's a really important point as well, of really focusing on the employees that are maybe at the different end of the salary scale, and getting to just listen to them and seeing what they're experiencing as well. Because for the employers and that may be earning six-figure salaries, for example, it is very easy to become slightly disillusioned with what it's like to live on £16,000, £18,000 per year, for example. So those listening sessions can be really powerful. And Tracy's mentioned that we're holding an internal financial wellbeing workshop this month with lifestyle coaching, how to complete income/expenditure forms and how to get support if struggling. I think that's fantastic, Tracy. So kudos to you on that. But financial wellbeing often is forgotten about. It's such a big thing when it comes to mental wellbeing, and correlates with the other areas. Would you add anything on top of that, Laura?
Yeah, I was just going to say that when you mentioned around it's not just the practical side of things, actually how much money do you have, but it's your relationship with money. And actually that's one aspect that I do tend to forget, and actually looking at the financial wellbeing content that we have on our platform, it really helps someone who is financially stable to keep a good financial relationship with their money. So yeah, it's that preventative and the reactive piece that definitely needs to be focused on as well.
Fantastic. And one of the things I wanted to touch upon was home-related stress. And there may be some people that are considering that's nothing to do with the employer and the business. Do you think that the employee experience now is going beyond just looking at 9 till 5, if there are 9 till 5 hours, to outside of the workplace? And how can we support people in their home lives as well, to reduce that figure of 33% experiencing relationships that are having a negative impact upon their stress levels and mental health?
Yeah, you touched upon it earlier when you're saying that actually in the last few years, those lines, especially for those of us who are now working from home, those lines between work and home life have definitely been blurred. And we are a whole person, we are human beings, and actually we can't just leave things at the door before we go into the office and function as normal and then go home and suddenly everything feels difficult again. That would be ideal, but it's not the way that we work. So actually seeing employees as the whole person and taking that individualized approach is really going to help you understand how people are coping at home, but also how that's having a knock-on impact at work. And I have heard that, oh, well, I can't impact my employees' sleep, so why should I be thinking about sleep? Or, oh, I can't support the parenting aspect of their life because that's separate, but actually it is all related. And if we understand what resources and demands are being placed on employees outside of work, that will better help them to manage the demands that are inside of work. So the thing that really screams out to me from the data is that workload, an overwhelming percent of people identify workload as a stressor, but actually I see workload as a bit of an iceberg, that actually that's just the tip. And there are lots of things underneath that are contributing to that difficulty. That's almost like the thing that you see, but then you need to go that one step further, understand what's causing that stress to help them manage those demands.
I couldn't agree anymore. And for me now, the employee experience is way beyond that. It's looking at their family as well and supporting them as a part of that. I mean, that's something that Champion are really looking to focus on going forwards. Now, the big piece of data within here, and one of the fascinating things of delivering the company health reports is that every single company is different within all areas of wellbeing. For some people, it's musculoskeletal health. For some people, it's more around the culture and the values piece. For others, it's around mental wellbeing. But the one common theme that we found with most organizations is that workload is very high.
I think it's every organization. I've never seen a company report without workload being at the top.
So what can we do about that? Because that seems like the holy grail, really. That, of course, we need to work to be able to provide for our customers, our members, for society, if you're working in the public or third sector. How can we actually challenge the workload element? Because 76% of people are saying that it's negatively impacting their stress levels in a significant way. Yeah,
and that's such an important point, is that actually we can't just say, oh, well, we'll reduce the workload. We can't, and I think when I've spoken to clients that's their initial kind of worry, that, well, my employees are reporting this, but actually we can't reduce the workload. Well, we're stuck between a rock and a hard place. Mm-hmm. But actually, as I alluded, that there is so much more that contributes to an employee's ability to cope with their workload. So if we use the demands, resources, seesaw, we can see that if you've got lots of demands and very little resource, then of course that's going to be very out of balance. And our resources, if we think just generally, have been depleted so much over the last couple of years. So actually increasing resources will then help employees to better deal with the demands that they're facing. So when we're thinking about resources, we're thinking about the level of support that the individual is receiving, whether that's increasing kind of one-to-one sessions to actually understand the pressures and to act on them. Perhaps it's around control. So we know that when people feel more in control of their work, then that helps to reduce the level of stress that they're experiencing. So increasing that, or giving as much flexibility as possible. I know this is quite difficult when there's so many different organizations, and it is harder in some than others. But really kind of looking to increase those personal resources. And I think the most important thing is speak to your employees, actually problem solve, use the analogy of the resource demand seesaw, because actually your employees know themselves the best. And there might be something that they just know will help them that actually hasn't come out in conversation before.
And that's happened at Champion before, where there's a process that's not quite working, it's leading to inefficiency. Just talking to people, because often they have a solution when there's boots on the ground, and management may not be able to see that necessarily. And Bex also mentioned psychological safety. Again, I could not agree anymore. Psychological safety and making sure that you have a psychologically safe workplace to talk to your manager. Your manager's very open about things, and you listen and act off the back of it is the best way to be able to reduce that figure. Because there are some times that workloads are high and we're highly efficient with it. It's when workloads are high but we're not efficient with it that comes the frustrations. Now, there's another point that's been made as well by Debbie that workloads are getting higher in our industry sector. Attrition is high. It's difficult to see, which means higher workload. It's difficult to hire, sorry, which means higher workloads for everyone else. And the whole Great Resignation's been a big talking point over the last year, and it's harder to attract the right talent as well. So that's having a knock-on impact, and there are so many elements to consider within here. But the first thing is to get that data, to see what employees are saying, to talk to them, to listen to them, and then seeing what you can do. And there are so many quick wins that we often find to reduce workloads where actually they're not really benefiting the organization by working longer hours. They're just doing it because it's always been done that way, for example. Yeah. So Laura, thank you so much for the stress section as well. That's been fascinating. Again, we could spend the whole hour on that. But looking at home-related stress, in my opinion, that's something that we need to look onto. Charlie's mentioned bring on the 4-day week. So obviously some trials going around there at the moment as well. So I'm fascinated to see those findings. But also focusing on work-related stress, listening to employees, and also taking into account financial well-being, making sure we're paying people properly, first of all, and then we're giving them the right awareness and education and coaching to being able to develop those healthy money habits going forwards. So the next section is around musculoskeletal health, and this is an area that has somewhat been forgotten about, with mental health taking the limelight, and for the right reasons as well. But what we can't afford to do is to forget about musculoskeletal health. Now, almost 60% of employees are experiencing current musculoskeletal health pain. That's a huge proportion within our workforces. And when we look at hybrid and home working, that accounts for 1/3 and more than 1/3 of our workforces, 17% in the office and 13% in other. Now, that's a really alarming statistic for our employees. And we talk about presenteeism. And so not just the absenteeism off the back of MSK pain, it's very hard to work when you're in chronic pain and you've got lower back pain, to concentrate, to be pitching in sales, for example, all the way through to delivering good customer service or being creative in the marketing department. That's very difficult when you're in consistent pain. And so there's a huge issue here. Now, one of the things that we are looking at is that 82% of people are sitting for longer than 30 minutes. So that's one very quick action that we could potentially put into action. And they're sitting on average, employees are sitting on average for almost 11 hours per day. Now, when we look at the top reasons for musculoskeletal health pain, lower back pain is the top one, neck pain, knee pain, shoulder pain. But then we look at our employees seeking treatment. 58% of those that are experiencing pain are not seeking treatment for it. So first of all, Laura, I just wanted to talk about how can we get musculoskeletal health on the radar? And it almost seems like physical health and mental health, there wasn't parity previously, but it's almost going the other way slightly. So how do we get the parity between them to focus on these really big areas?
Yeah, definitely. It's interesting. We always say, just as everybody has physical health, we have mental health, but actually just as everybody has mental health, we also have physical health. And actually it really impacts all areas of well-being. When you're in so much pain and experiencing chronic pain, it can impact sleep, it can impact mental well-being, which of course then has a massive impact on productivity and presenteeism, as you say. So I think, again, there's an awareness piece. I don't think it helps that musculoskeletal health is such a mouthful.
Yeah,
and actually, before I started working here, it wasn't necessarily something that was on my radar. And I didn't really have an understanding of how it was so intimately connected to all other areas of well-being. So there is definitely an education piece to keep this conversation going about, actually, to look after your body, you then look after your mind, and of course, the other way around as well. And then it's also educating, well, okay, so I'm experiencing pain. Where do I go? What do I do? Who do I speak to? And obviously, actually, quite a few of our clients have physiotherapy, like the cash plans, where they can speak to physiotherapists, osteopaths, chiropractors, all sorts of people. I think very similarly with the EAP conversation that we had, that signposting needs to be very clear. It needs to be one click away so people can access the support that they need.
Yeah, I couldn't agree anymore. And again, it's providing those services, but the awareness to those services is going to be vital. And to the bottom line, and there's a huge link between musculoskeletal health issues from our data and mental health issues, and a bit of a chicken and egg situation with that. And Caroline's just mentioned exactly the same as well. And this is really important for us to draw those links between the both of them. So making sure we're making those services available to people. Again, communicating that effectively is absolutely vital within there. But also, if you can't afford to offer these services, making it clear where people can access support and help. And the final thing that I would add as well is having musculoskeletal health check-ins as part of your one-to-one with your line manager. And mandating that and just checking in to see how people's bodies are, because often they're the things that flare up first before people talk about all of the stresses and so on going forward. So it's a really nice gateway within there if you're to mandate that across your team.
And that kind of ties into the prevention is better than cure. One of our team members, Rich, shared a fantastic quote that prehab is better than rehab. So definitely taking a preventative angle. So implementing the quick wins that you were alluding to, Harry, in terms of just breaking up sitting periods, creating a workspace that actually facilitates that. So making sure that there are short breaks between meetings. If you're back to back on Teams or Zoom, then actually you're not going to have that time to stretch your legs. And actually the most important thing is keeping the body moving. So it's not about going for a 3-mile walk every day. It's about keeping that spine moving. And I'm sure John Daniels, who I did see was on the call, could talk much more eloquently about this than myself. But I guess the bottom line is that we as human beings were built to move, and we are doing less and less of that. So that's a super quick win, along with things like ergonomic desk setups. So making sure that there are the regular desk assessments for employees, both in the office and at home. There is some fascinating links, as you picked up on in the data. Actually, people who are working from home were more likely to experience MSK pains. So the setup of people's desks is perhaps called into question, whether people are still working at dining room tables and in the kitchen. So there are a lot of quick wins around MSK health, which is why I really want people to actually start prioritizing it and making it a focus for the business.
I completely agree. And hopefully it's something that I'm role modeling, Laura, around walking meetings as well. And so when I'm on the phone, there's no point in me sitting down at my desk, get up, get out, and making sure people are changing their posture as well, throughout the working day. I like the back-to-back as well. I made a note of that. So there might be a little campaign in that at some point as well. Paul's just mentioned the Pomodoro method as well. I have a little tomato timer, so you could get that for your team as well. And 25 minutes on and 5 minutes just walking around has really helped me with my musculoskeletal health and productivity. So on to productivity now. I don't think that was meant to be that smooth. But in terms of productivity, this is a huge area to make that business case. Now, 53% of employees at the time of going through their assessment were saying that tiredness is impacting their productivity. That's over half of people. And I think actually it'll be all people at certain points of the year will be experiencing this. 28% of people are saying that high stress is impacting their productivity, 21% with mental health, and then 18% female health, headaches, and they are huge areas as well that we need to focus on. But also when we look at the correlation, and this is something that we get asked by a lot of our members, especially the FDs that I love talking to, around what is the correlation between well-being, what's the business case within here. I will just show them this graph, that quite simply high levels of mental well-being and positive levels of mental well-being, good levels of sleep correlate with productivity within here. So Laura, what would your message be to those FDs that are saying that, well, why would we invest X amount into well-being? What's the tie-in? What would your message be off the back of this data?
Oh, that it's just so clear. And I'm a bit of a data nerd. No, I haven't shared that yet, but I don't know whether that's come across already. But I actually squealed a little bit when I saw these results, because it's so clear that the better your mental well-being, the more productive you are. So it's just so important that actually the leadership teams see that well-being is that bedrock for performance. And I know Jack Green, who works with us, this is his his bag, and this is what he preaches to everybody. And these graphs just show so clearly that that actually, if we prioritize well-being and invest in well-being, then that's going to improve the bottom line. And actually bringing it back to the workload data that we spoke about earlier in terms of stress, is that actually, if you're addressing these different health areas, if you're supporting people's mental well-being, levels of stress, physical health, then actually they're going to be in a better place to cope with those demands that are being put on them. So I think there's a lovely relationship there between well-being and productivity and performance ultimately at work.
And I think there were probably all the other areas that we could have included the correlation between as well. But we ran out of space on the slides, unfortunately. We could only fit a few on. And just one other thing that I'd like to touch upon with productivity as well. So we've got 10 minutes left of the session, and we want to go into behaviour change next. But tiredness is a big thing, and that's no surprise to us all. I experienced tiredness and fatigue at times last year, and I'm sure we'd all agree with that we experienced it at times. What can we do about tiredness and reducing the risk of burnout within our organisations?
Yeah, definitely. I think a lot of the stuff that we've already spoken about in terms of that individualized approach, understanding the different pressures that are on the individuals, listening to employees and acting on it. But I think there's also a recognition that needs to happen around that actually we can't be 100% productive 100% of the time. And actually if we have that understanding that, okay, actually, maybe it's this time of the day or this time in the week that, I'm at my best, I'm performing at my best, and I'm going to capitalize on that, using the Pomodoro technique to keep yourself engaged. But then equally recognizing that, yes, there are times of the day where naturally I just feel a bit tired. It's part of our evolutionary history, the 2 p.m. slump, as we like to refer to it, that actually in those times where you do feel tired, work smart and plan those less demanding tasks, the admin tasks, the emails, whatever it is that you feel that actually you could do at that point, to reduce the overall kind of work load, the pressure that you're putting on yourself by working smart and hard.
When I always say that in terms of working smart and hard, the two need to come together. One thing I'd like to ask as well, what was the specific data in terms of when employees are most productive and least productive? It wasn't something included in the deck.
So most productive is 10:22, so about 10:30 in the morning. Very specific. So that was the average time that employees said that, yes, I feel at my most energetic, I'm doing my deep work, and this is where I perform at my best. And then I think it was around 3:30, definitely mid-afternoon, where actually they recognized that, I'm in a bit of a productivity slump. I've not got the highest levels of energy at the moment, and this is when I'm least productive. And actually leadership can use this information as well. So, booking meetings when there's, really important meetings where you need to be creative, or, decisions are going to be made, schedule them at the best times that work for your organization. I think there's lots of scope in that, when actually it's quite a quick win.
Yeah, again, really quick win. And we can just arrange walking meetings again at 3:30, get outside, get up and about, and also just encouraging healthier nutrition choices, because that's one of the reasons why the slumps are occurring. And that's a huge focus for us as well going forward. So with productivity, we know that tiredness is the main issue. We need to acknowledge that with our team, again, speak to them, offer them the right services within here that are personalized to them, but also plan your days and your daily architecture around this, and your work architecture as well. So in terms of behavior change, and this is the last section that we're going to go through today, but it's a major section, because without behavior change, our organizations won't evolve, it won't improve, and the well-being outcomes won't be there. And behavior change is really the holy grail. So one of the big areas is that 94% of employees said that they want to make positive changes to their well-being. And the areas that they want to focus on, interestingly, is around their energy levels, tying into tiredness once again. And we've just had a message in terms of from Julia saying tiredness can be linked with mental health. Absolutely. So interventions around improving energy levels will then improve mental health, improve all of the other areas. 53% said activity, 46% around weight status, 43% around sleep and mental health as well. So they are the main areas that employees want to focus on. Now, we've got to just mention that whilst mental health is often the main focus of our wellbeing strategies, and rightly so, we need to focus on these other areas if we're to get our employees engaged. So really targeting things around energy levels, around activity, providing them with workouts and a workout platform potentially can be hugely important within here. The other thing that I'd like to touch upon as well are what are the barriers to them changing, because without addressing these barriers, we're not going to then make those changes going forwards. And willpower was the top one. A lack of time, work commitments and family commitments were the main ones within here. What are the things that we can recommend to overcome those barriers, Laura, within our organisations? What can we do to be able to elicit behaviour change?
Yeah, so it's about creating space for change to happen. And the way that we're going to do that is, of course, by using Feast. So making things fun, easy, attractive, social and timely. And actually, if we address those areas, then people will be more able to engage, more motivated to engage, and then be able to stick at it in the longer term. We want to remove the sludge, so remove those barriers. And interestingly, the top three, so we have willpower, time and work commitments. So it's thinking actually what as a workplace can you do to remove that barrier, to increase the time that people can spend and also create that space. There's simple things such as role modeling behavior. So coming right back to the beginning in terms of, okay, actually I'm going to go to the gym for half an hour at lunch, and outwardly telling your employees that and saying that actually I'm creating space in my day to engage in whatever it is that they're doing. And that will really have a positive impact. I think there's also a recognition around addressing the wants and the needs. And when they align, you've hit the jackpot. So here in this data, we have the energy levels coming at the top, which is really important. So that motivation to change is there. The employees needs to focus on boosting their energy, and actually they want to do it. So that's the perfect recipe for enabling that behavior change. So if we create the space, address those barriers, it should all fall into place.
Absolutely. And the Feast model is the thing that if you're not focusing on that already around your comms, around your wellbeing strategy, I really encourage to look at it. So could you just name those 5 areas again? So fun, easy, attractive, social, timely
and timely. Yeah, so making sure that all of your interventions, initiatives, whatever it is that you implement meets those 5 criteria, and then engagement will be not even a choice, it's obvious.
Makes it easier for everyone. So we're coming to the end of today's session, so thank you so much for engaging with it. What I would love to do is, if you've got any specific questions, please send them through to me personally on LinkedIn. I'd love to connect with you as well. Send them through on the chat now and I can get back to you later on, or send them through to my email. The Workplace Health Report is now live, and Alex, that was so timely, it was phenomenal. So you can download it using that link and access all of this data. And we're going to be doing this every year to support people like you in driving positive well-being going forwards. Our mission is to make healthier, easier for everyone, to make well-being more inclusive, more accessible and more engaging. And if you'd like to find out how we do that at Champion Health, Jack and I would love to talk to you. Thank you so much for today's session. Thank you, Laura, as well. Thank you for being so engaging, and we will see you soon.
Fantastic. Thanks, guys.